Mpenzi mtazamaji, asante sana kwa kusalia nasi dakika 11 baada ya saa 1 asubuhi, lakini kwa haraka tu tuangalie mambo ya magazeti. A dose of hope ni katika gazeti la The Standard ukurasa wa kwanza. Ndo hivyo hali ilivyo. Najua kwamba Wakenya wengi wanafurahia sana matangazo ya rais, na kuna vile vile wengine ambao watasema kwamba labda hangefanya vile. Tutasikiza hayo kutoka kwa mhakiki wetu asubuhi ya leo, Sasha, ambaye tayari yupo hapa. Kenya under curfew ni katika gazeti la The Daily Nation asubuhi ya leo. Ni masuala ambayo yameandikwa katika ukurasa huo wa kwanza. Uhuru's plan to save jobs declares curfew. Ni masuala mengi Rais Uhuru Kenyatta aliyazungumzia jana katika hotuba yake. Asante sana Sasha kwa kukubali kuja asubuhi ya leo. Jana baada ya Rais Uhuru Kenyatta kutoa hotuba yake katika Ikulu, alizungumzia sana that there'll be a curfew that is going to run from 7 p.m. to 5 a.m. in the morning. Many people would say that it's really okay, but is it helping in any way?
First, I want to say thank you, and maybe to continue informing Kenyans to wash hands and follow the government regulations on COVID-19. But then about the curfew, it should be understood why the curfew comes 7 to dusk to dawn is because most Kenyans after work is when they meet maybe to talk or have some other discussions. So the curfew is simply meant to allow Kenyans, once you come from work, you go home. Usikue na time ya kwenda kumwona jirani, anko rafiki yako, ama mkutane pale nje katika pale place mnaishi.
The main part as to why Uhuru would offer or give out that curfew is because he want to break the direct contact of people.
Sure, that is the main reason, because anataka to reduce the number of people who come together, talk or discuss their own issues. So he wants after job, if you are going to job, you stay at home. It is one way of implementing this thing of kaa nyumbani, as in avoid contact with the people. That is the main aim ya curfew. And also to allow the medical staff wakuwe na ample time, because when there is a surge of cases in the hospitals, then it means the hospitals are so much overwhelmed. So the president is just trying to reduce or break the channel of spread of the virus, and which to me and to many Kenyans we need to support, and it is a good thing. Yeah.
No. Another question is, I saw people would want to also ask, they were saying, if you own a supermarket, who will come to buy and we are under curfew?
You see what is happening, we are in a situation whereby you cannot allow things to work normal. Most Kenyans are not going to work, so probably we expect most people to be shopping during the day. And those who will be shopping late, maybe after work. Most Kenyans comes from work around 4 onwards. So the president or the government expects that when you're coming from work, if you want to shop, you pass by the supermarket as you go. But for most Kenyans who are staying at home, who are not working, you can still do it during the day. You don't have to come to the supermarket in the evening. But again, you understand all sectors have been affected. So everyone needs to understand. These are situations that no one would wish to happen, but it is happening. We need to streamline our daily lives.
Now, so that one would mean that we also have what we call ray of hope, in the sense that at the end of the day, someone who is earning 24,000 is now getting it is given an version of 100% waive of the tax. Is there in any way that one setting a ray of hope for that person who is earning 24,000 below?
For sure, if you've been listening to discussions of Kenyans online and even on the streets, most of them have been complaining most Kenyans earn so much little that they cannot stand maybe a curfew or a complete lockdown. So the president is simply preparing people for a possible lockdown. That if I'm giving you 100% relief from tax, then it means the extra money that I'm giving you, plan yourself. Also take precautionary measures, because you are looking at a situation whereby probably when there is a complete lockdown, you need as a person also to plan for yourself long term. As in during the lockdown, what will you be eating? Plan and caution your family enough. So what the president is doing is, he wants the low income earners to also have a time to plan themselves. And this is in preparation for unforeseeable, a future that you are not able to predict. Because we are talking of a lockdown, and any other serious Kenyan should just see there is a lockdown coming. Whatever the president was saying yesterday was a preparation of a lockdown.
Why do you think there'll be a lockdown?
I completely think that there is going to be a lockdown simply because look at the countries that have been adversely affected by the virus. Which country has really worked without a lockdown? We should not expect our situation to be so unique. To break the
But looking at our situation right now, we have one person who has already recovered from the virus.
It is a good indication that Kenyan doctors can treat a person from COVID-19, and that is a hope to many other Kenyans. But also we need to understand, even those countries who are registering high rate of death, we have also big number, more than 80% of the patients worldwide, 80.9% have recovered with mild symptoms. That means most patients of COVID-19 recover. Those who are dying is a small number, but the problem is the spread of the virus is so high, such that at certain given point, the hospitals are not able to cater for all the patients. That is the worry with this disease. But when it comes to terms of the mortality rate, it is very low. So the only problem is the medical professionals cannot hold the surge in cases. Most patients coming in thousands, you cannot hold all of them. So that's why you see this virus is harassing people. But in terms of the death rate, it is a very small percentage of the entire percent that died.
Economically, President Uhuru Kenyatta, when yesterday he gave tax breaks majorly to people, are we expecting the rise in economy in any way?
Not really. This is meant just to cushion an already struggling economy. We are going to have some big problems in terms of economy. But again, what the president was doing is he wants Kenyans not to feel, he wants the effects of COVID-19 not to really affect most Kenyans. But I would also urge the government to make a follow-up, because I've seen him reduce on the VAT tax and other taxes. That means a common mwananchi should feel the impact. So they need to follow up on the prices of commodities, especially food items. They should not allow traders to continue using COVID-19 as a way of fleecing Kenyans out of their cash and hiking prices for no reason. We still have enough supplies in the market. So the government should make a follow-up and ensure that whatever the president did is effective downwards. The common mwananchi is feeling the effect. It should not remain a statement, but yet when you walk to a supermarket, you are still buying, the prices are still hiking. So I believe there should be something done to do a follow-up.
So there should be someone who is monitoring this, and also that goes to the president right now. I know someone is watching and would want to know what are some of the measures that President Uhuru Kenyatta is going to put in place. But then there's this thing that also medics are at a high risk of inhaling coronavirus during procedures. WHO yesterday, giving a statement, said, gave a warning that health workers are at high risk of inhaling droplets of the new coronavirus during medical procedure. Are we really ready also as a government, also the country itself? Are we ready to support the medics to evade coronavirus?
In terms of readiness, it's not something you can really be sure of. But I want to say Kenyan medics are handling this thing with a good experience. You remember Kenyan medics helped fight Ebola virus in Liberia and Central Africa, which was also more contagious as COVID-19. So we are coming in a situation whereby we've tried before. But again, in terms of protecting the medics, all you need to do is ensure also the medics wear the right attire when they're going to attend to the patients, and we need to provide them with that attire, the suits, the medical suits. So the government should ensure, in as much as we are going, we are using a lot of the medical equipment, there should be a good stock for the medics. Whichever the situation, even if there is a lot of surge or a big surge of number of cases, then the medics need to be protected. We need to have a good stock kept aside purely for the medics. Because if we can lose our medics, let's say even 1,000, it means we have a very big problem in our country.
Na mpenzi mtazamaji, bila shaka tunaendelea kuzungumzia masuala mengi ambayo yapo katika magazeti. Moja kwa moja ni kufahamishe kwamba kuna classification of critical and essential services. One, medical professional and health workers ndio wanaruhusiwa kutembea wakati wa makata haya ambayo yametolewa kwamba hautaruhusiwa kutoka nje kuanzia saa 1 jioni hadi saa 11 alfajiri. Vile vile National Security Administration and Coordination Officers, Public Health and Sanitation Officers in the county governments also. We have licensed pharmacies and drug stores, licensed broadcasters and media houses, waandishi wa habari na vile vile vyombo vya habari, Kenya Power and Lighting Company, food dealers, distributors, wholesalers and transporters of farm produce, licensed supermarkets, mini markets and hypermarkets, licensed distributors and retailers of petroleum and oil products and lubricants, licensed telecommunication operators and service providers, licensed banks, financial institutions and payment financial services, fire brigade on the emergency response services, licensed security firms. Kuona hili Sasha, kwamba tayari kuna watu ambao wataruhusiwa kutembea, kwa mfano waandishi wa habari watapewa nafasi ya kuripoti sisi tupo katika hatari ya kuambukizwa kirusi hiki, au wote ambao Rais Uhuru Kenyatta ameweka kama classified as critical and essential services, how are they going to be protected against the virus?
Terera, I want us to agree that in combating COVID-19, it all requires cooperation, collaboration, and working as a unit. So, as for example, let us use the media persons. They need us also, their bosses need to provide them with protection. If you are going to cover a story, then you need to take all the necessary measures. And also the media fraternity should also reduce on the number of people covering a story. You cannot have 20 cameras covering one person. Maybe you need to find a way whereby after you've set the camera, or you limit the number of media stations covering one story. And also the journalists going on the field, you need to take the necessary precautions. The social distancing, the masks, and all other aspects that the government have advised, you need to put into place, because there's no government or somebody that will come to help you protect yourself. You have to take it as a personal initiative and try and as much as possible, even as you are working, to protect yourself. Yes.
Mpenzi mtazamaji, kwa sababu ya muda naomba kutie kikomo hapo kwa masuala ya magazeti, lakini nikukumbushe kwamba tayari kuna ray of hope kwa sababu ya kuwepo mtu mmoja ambaye tayari anasemekana kupona kutokana na kirusi hiki. 100% tax relief for Kenyans earning 24,000 and below per month. Reduction of payee per SU earn income tax rate to 25% from 30%. Boost for companies as corporate tax to be reduced to 25% from 30%. Injection for SMEs, turnover tax down 1% from 3%. Additional shilling 10 billion for the elderly, orphans and the vulnerable through cash transfers. Also, this one, before I let go of Sasha, I would want to ask something. Don't you think that President Uhuru Kenyatta and Deputy President, even the CSS and the administrators, should remain getting the same salary now that they have cut their salary to 80%, Uhuru Kenyatta 80% and Deputy President 80% salary cut, 30% for cabinet secretaries and chief administrative secretaries, and 20% reduction of principal secretaries? Why can't we leave these salaries to remain this way even after Corona?
First of all, I think the president did a good thing. But again, if they can earn this amount during these straining moments, then it should just be made a law that this is the salary these people are going to earn. And in regard to what the president did yesterday, I was really waiting for the president to declare a state of emergency. If the president did so, then it would give him, it would invoke the powers that the president has but cannot practice them under normal circumstances. Now, when you come like for salary deductions or cut, the president should have just given an order. All public servants at this job group levels, you get a salary cut of this amount, and it remains an order. But now with the current circumstances, he has to coerce them to do it voluntarily.
But we have teachers also who want a little more. So I guess not all civil servants.
That's why he said that certain job groups, he would choose maybe which job group to effect that order. So the president in the coming days should now declare a state of emergency. That will help him fight COVID-19 in a very elaborate manner. He would be giving orders rather than requesting people. So in terms of salary, I wish it remains the same.
Thank you very much Sasha for coming. Kabla nikamilishe masuala ya magazeti, kuna bingwa moja hapa anaitwa Michael Njoka. The curfew is just a stupid move. The disease does not have a curfew. Until people start dying on it, then you will realize this is a serious issue. What Kenya needs is a total lockdown. Ni maoni yake Michael Njoka. Mpenzi mtazamaji, endelea kumimina arafa yako kupitia 2207 2207 na vile kupitia Facebook TV47 Kenya, Twitter ni @TV47KE, @Terry Emmanuel 21. Zungumza nasi ili nawe uwe pamoja na wale wanachanganua na kuchangia pakubwa katika runinga ya TV47. Unaendelea kutazama runinga ya TV47, uko na mimi Emmanuel Terer. Lakini kwanza tuende mapumziko. Kuna mgeni mwingine tayari naambiwa kwamba amekisha wasili. Tutazungumzia namna na jinsi ya kufanya kazi vile vile wakati huu wa kirusi cha corona.